The medical brotherhood in India, whenever it has been faced with a deep seated problem, a problem that requires structural thinking, that requires a systematic analysis to correct all the anomalies that has been going around, honestly, more often than not, it has responded with a classical knee-jerk response, or there has been examples of one hypocrisy following the other. I don't think any of you have missed in the last few weeks a series of statutes from the National Medical Council as how doctors should behave, what they eat, what they should drink. I was reading down the guidelines. We did not pick up any statutes regarding a doctor's married life or love life, but we will come to and discuss many of these statutes one by one. The one draconian and classical knee-jerk response has been in the area of generic medicines. By the way, their NMC's sort of statutes or advisories for doctors almost reminded me of the movie Ten Commandments, with Noah perched himself on the top of Mount Sinai and held the two tablets, each telling the Jews as to how to behave themselves. So if you want to have a mental picture of how the NMC is conducting themselves, I think they have a mental image of acting like Noah on Mount Sinai. Now, what's wrong and what's right with the idea of generic medicines? Of course, generic medicine, what does generic medicines mean? I think some of you have some idea, but most of you carry a lot of misconceptions as what generic medicine means. Generic simply means that these medicines are not branded. What is a branded medicine? If you happen to be a pharmaceutical company and you, through your labor, your intelligence, your effort, has come up with a particular drug, which we call a particular molecule, that molecule may be used in treatment of diabetes, blood pressure, cancer, heart, neurology, gynecology, whatever. And if that particular drug has found to be useful, have more benefits than side effects through a series of clinical trials, then that drug will be permitted to be sold, to be used in medicine, and to be made available to the people through the medical outlets. And you, as a company who researched and came up with this particular drug, you will have the privilege or the rights to this particular drug for a period of 20 years. When it becomes 20 years plus 1 day, you lose that privilege, and this particular molecule, this particular drug becomes available to all other pharmaceuticals company if it is still useful, if it still has a lot of clinical applications, if a lot of people are still using it, then all other pharmaceutical companies will have the right to manufacture the same drug. Generally, if the pharmaceutical company who starts off the process obviously commands a higher price for the drug, because it is not just the cost of the basic raw materials, it is the cost of manufacturing, it is the cost of research, it is the cost of marketing, it is the cost of publicity, establishment, everything else. Generic medicines, once the proprietor has lost its 20-year privilege, is bound to be cheaper. Good news, very good news. All of us, each and every one of the 9.5 lakh doctors on the surface of this country, acknowledge the fact that generic medicines in bringing down the cost of treatment is good thing, period. Generic medicines does and should cost less than the branded. Brilliant, full stop, good thing. But then the first question that comes, which the government of India, the health ministry, the pharmaceutical arms of the health ministry, commerce, industries division, there are a whole lot of stakeholders in this business. Then the first question they ought to answer, question number one, is why do we have for a particular drug which is not in the 20-year period right now, what is the need of having both a branded and a generic? What is the need for having 55 brands of this particular drug and n number of generics of the same particular drug? It is not necessary at all. So cannot the health ministry, cannot the pharmaceutical controlling agencies make up their mind and restrict the number of brands in this particular situation to a tried, tested, certified, safe, effective, generic brand only? What is stopping them from doing so? Question number one. Question number two. If the government's heart is bleeding to reduce the cost of pharmaceutical expenses, the out-of-pocket expenses, the enormous amount of money that an average Indian dishes out to buy medicines every year, then whether you are branded, whether you are generic, the MRP control, government is a very important stakeholder, is a very important brake and accelerator in controlling the retail price of medicines in India, the much abused MRP system. So whether you are in branded or whether you are in generic, if it comes to the government's notice that certain prices are going overboard, then with all due respect, sir, what is stopping you from exercising your rights of MRP control? Secondly, have you thought it out for a moment that the MRP business today in medicines has almost been reduced to a joke? What is printed on a strip of medicine? How much is the manufacturer selling it to the retailer, to the wholesaler for? How much is the wholesaler selling it to the consumer? Is totally a kind of an area which is shrouded in unknown and in mystery. So do come up. If your heart is bleeding to have a more honest, a more transparent system, which at the end of the day reduces the cost of medical treatment, then please stop this mammoth fiasco that is happening about MRC and devise a system which is which is truthful, which is honest, and which a simple consumer, a person buying 5 tablets of any particular drug, can make out what on earth is happening. Question number 3. This entire chaos of pharmaceutical distribution, delivery and sales in India, why is it necessary to have 1 or couple of kilometers of an area completely littered with 100, 200 medicine shops? Why is it necessary at all? Why is it necessary to have you go to the rural outposts back of beyond, where people are not interested to set up a medicine shop? There a person has to walk for kilometers after kilometers, miles after miles to access a medical shop. And you come to a city, you come to a busy area, expectedly there is going to be an uncontrolled flea market of medicine shops, one after the other after the other. Is this a mark of any kind of systematic thinking? And each of these 200 medicine shops, which will be like a can of sardines, one after the other, will sell the same medicines, will be completely involved in an exercise of undercutting one another. All kind of shady practices available, snooping patients from the government outpatients department. There will be medicine shops, n number of them outside of private and public hospitals, and there seems to be no regulation, there seems to be no systematic approach to this business. It is not the doctor in India who wanted or who is responsible for this uncontrolled diarrhea of pharmacies opening anywhere and everywhere. It is not the doctor in India who is responsible for this utter chaos of one particular basic drug being available in 120 different brand names and trade names. Who has done that, sir? It has been devised by the opportunists, by the people in the trade, industries and health departments of both the state and the center. This curse of a total chaos, both in multiplicity of brands being available across millions and millions of unwanted pharmacies, this curse has been thrust upon the Indian doctor. Please remember that. You give anybody a license to set up a medicine shop, you and I know how most of these licenses are obtained. 90% of these medicine shops would never have seen even the likeness of a certified pharmacist. You give all Tom, Dick and Harry companies to come up with a cut and paste, a carbon copy molecule, A1, A2, A3, A4, A5, etc. Why do you do that? You know that all the palm greasing that happens in this process. It is not the doctor who wanted the same antihypertensive molecule to be existing in unnecessary 25-30 versions. And it is to sell these 25-30 versions that 200 cluttered medicine shops will be engaging in all kind of underhand practices, and ultimately people like yourselves will come and sermonize to the doctors for the chaos in which the doctor is not a stakeholder at all. So if you were really wanting to cut the cost of treatment of the people in India, then please stop shedding the crocodile tears. Analyze, see for yourself. If any one of you have had the opportunity to leave the confines of your air-conditioned cabins and offices in these ivory towers of government institutions, then come and see what is happening on ground level. Answer the question, why on earth do we have 100 different avatars of the same molecule? And why do we have clutters and clutters of medicine shops who are only engaged in one thing, which is completely shifting one drug for other, what has been prescribed, and all kind of underhand means which is possible. And in this process, a chaos which not only continues but multiplies day after day and week after week. A doctor has not devised the policy. A doctor is not responsible for this chaos. Another matter that has been highlighted many a times across discussions is, fair enough, you have a generic medicine in hand. You are singing its praises. Have you devised any kind of certification that a prescribing doctor can look up and see that this particular generic medicine has been certified for its efficacy, for its safety? Where is that mechanism? Simply because some chap in some bootlegged pharmacy across the road may be producing something of which I have no idea, and that particular drug may be drastically cheap, does not give me the right to prescribe this to some hapless, unfortunate patient. Efficacy, safety is important. Do not shut your eyes to the fact that there are various reports which points out about 10 to 15%, like the fake currency in circulation, about 10 to 15% of the inventory of pharmaceuticals in India may be fake. How are you protecting and improving this authentication and certification? And the other question, that as we hold and sing the praises, which we should, the pharmaceutical industry in India has done very well. But do remember, the pharmaceutical industry in India is the most unoriginal industry that ever existed. The pharmaceutical industry in India flourished under two pretexts. Number was around the 70s, when Prime Minister Indira Gandhi removed the patent right completely. And later on, for quite a few decades, we had this very disingenuous practice where patents were not given on a molecule but on the process of manufacture. And this allowed company after company after company to flout the international patent laws. If a particular medicine came out somewhere in Europe, in America, within 7 days a carbon copy would be out in India, because India had the most slipshod, shortcut kind of patent rules possible. I believe some correction has been done to that. You will ask yourself, then why on earth did the companies allow this formula to come to India? Simply they had to reach out, they had to sell to this huge market of 130 crore people, they needed the money, and that would be done on all backhander based insider arrangements. And as we sing the praises of generic medicine in India, having 20% of market share and 80% of market share, do spare a thought for one thing, that at one time India used to be the principal site of manufacturing the raw material, the active ingredients. So, as the pharmaceutical industry in India made a lot of quick bucks on the cut and paste and photocopying principle, the pharmaceutical industry in India, I believe, has significantly moved away from the practice of making the mother raw material, which I think today is to a great extent being controlled by China as of today. So come COVID, come an influenza pandemic, come anything, you are looking out for the raw material of a simple stuff like paracetamol, you will not find it. Why? Because we are only importing the active pharmacological ingredient, breaking up into tablets, having some fancy foil packaging, and selling it through our crores and crores of a completely fish market, cattle market of pharmacies. So as a doctor who is an easy sitting duck for all the sermonizations that people like NMC come across with, for the nth time, for the infinitesimal time, we want to reach out to you and say that don't take the easy way out and the populist business of slapping a kind of rule of the road for doctors. A lot of structural, fundamental changes, reforms needs to be done on how many drugs, how many brands are actually made available. Number two, who are the people who actually sells them? We do not need this cattle market of medicine shops and pharmacies. We do not need this clutter of a particular drug being available in 50 different forms. We do not need this untried, untested combination molecules being sold willy-nilly across the medicine shops, but we do need the generic medicines being certified, authenticated for safety and accuracy. So as you take the easy way out, as you deny to look into all the structural problems of pharmaceuticals, drugs, different tribes, how drugs are delivered in India, I think far more midnight oil needs to be burned, far more deep thinking needs to be done, and just shooting, pointing a gun, holding a gun at the head of the poor doctor who is largely disorganized, who does not have a strong professional voice today, is a classical knee-jerk response, is a classical hypocrisy. So we wish that NMC will revive itself will revive itself from this knee-jerk response of taking an easy way out and come into a structural solution for what is a really, really serious problem in Indian medicine today. Thank you.